This is a short introduction to collaborative learning and practice, or CLIP. I'd like to acknowledge John Kenilworth, the CLIP Manager of the Health Academy at Lancashire Teaching Hospitals, for the support and guidance she has given us. We're going to be looking at what CLIP's all about, what coaching skills can be used, and looking at coaching and mentoring, and looking how it may be a good idea to run your CLIP area. Our key drivers to improve the students' placement learning experience in order for them to attain competency and proficiency, but to get a wide range of skills to enable them to become registered nurses. High quality supervision and mentoring isn't always so easy to achieve with the staff and mentor shortages that we have at the moment and the increasing demands that we have on nursing. Organisations need to attract and recruit and retain students into their roles, and good placement experience equals recruitment. All of our recently graduated students who participated in the survey said that the quality of a placement influenced their decision on where to seek jobs. To get more nurses into the system, increasing student capacity, the numbers of students that are trained will actually secure and concrete the future of our profession. So let's find out more about CLIP. First introduced in Holland, now being implemented across the United Kingdom. Students work together in groups or teams using coaching techniques with each other. They are supervised by a registered nurse. Also contributing to coaching is the support workers as well. The registered nurse takes a step back, predominantly observing, but uses coaching techniques to facilitate learning and development, putting the student in front, let them learn by doing, enabling the students to work together, reflecting on what's currently going on and current practices, expand, refine and build their new skills, share their ideas and solve problems together. Enabling students to holistically care for patients as a team enables them to become familiarised with home working very early on and their roles and responsibilities in holistic patient care. So students are allocated to a team on a daily basis. It's usually part of the clinical area, maybe 2 bays and side rooms or 1 bay. The rest of the ward functions as normal. Students are each allocated total responsibility of 1 or more patients depending on their experience. For example, the first year you may say that's your patient and the other students will manage the other patients, but they also work together as a team, delivering the care that they've planned and decided on. They can access the pathways in relation to their patient's journey, and we advocate they have a weekly reflection session with their clinical manager and their supervisors and mentors, which can be joined by academic staff that are linked to the area. It's been found that CLIP doesn't really work well at nights because of the small team that's on duty at nights, but however you can consider how you might want to choose to implement that. So mentors. Each student is allocated a mentor. However, they may not work that frequently with the student. They're working under indirect supervision. They're getting feedback from the registered nurses who work with the students to form the basis of the assessment. Mentors still have set goals, meet for formative assessments and summative assessments, and a mentor is available to all students for 40% of the working week. So if you have several mentors in your area, you may allocate the students between them, and one of them should be on duty for the majority of shifts. So the benefits of embedding CLIP into practice: it does rapidly develop confidence and leadership skills as students coach each other as well as being coached themselves. They take on greater responsibility for their learning. Most students we've spoken to in other areas where CLIP is in place feel that they have increased satisfaction with areas that run CLIP. It develops their thinking, confidence and their clinical reasoning and clinical decision-making skills. and also improves their reflective skills. It does increase their ability to deal and resolve problems. It builds their self-esteem, and it also increases the preparedness for them to take on registered nurse roles and increases their motivation. For the staff working, they get that collegiate support working across the whole team. It increases job satisfaction and motivation, job enrichment and performance, but mostly good recruitment and retention to that area is greatly improved. So, what is the difference between mentoring and coaching? Well, in mentor you talk, you answer questions, step in, provide care, the student observes, directs the students, allocates tasks and identifies learning opportunities. With coaching, the coach listens, asks questions, steps back, allows the students to learn by providing care, watching the student, but let their student direct their own learning, and also allows the student to identify what they need to work on, and using that whole environment as a learning environment and enabling holistic care to be embedded in at an earlier on stage. So, the NMC is going to require students to graduate with coaching skills as part of their, and expect them to take that into registered practice. So all our students have been prepared to peer coach, first years as well, but year 2 and 3 are expected to keep logs to reflect and use as evidence of competence in teaching and facilitating others' learning. Mentors are being trained to develop coaching techniques as well, and more that get into the swing and hang of coaching, the more it will be easy to bed this into practice. We advocate the GROW model for our students and mentors and those supervising in practice. And it can be applied to the whole placement, a day's work or an hour's activities. We use Whitmore's model, GROW, looking at what goals, where do you want to be, but what's happening now, what the reality is, what that means to what you're going to be doing or need to be doing, the options, and the what will you do. So Whitmore adds a little more. So when you're thinking about goals, think about these kind of things, explore different facets of what needs to be done. What is the reality, what needs to be done, but interesting asking the students how they feel about the reality, especially the fact if they feel they don't have enough knowledge to be able to carry out what's required. It's important to recognise that and to work around developing their confidence. Exploring options with them. Well, instead of saying what you need to do is this, this and this, you need to turn it and you need to say, what could you do? What needs to be done? How are you going to go about doing it? Who are you going to get to help you with this? Where do you go to find out? And then what actually happens? What you're going to do? And then you can bring it back again, thinking about where I am, what are the goals? If you give advice, it reduces the ownership, causes the learner to blame the coach if things don't work, and reduces resourcefulness, undermines the learner's choice, and prevents exploration. It's all very well giving advice, and there may be some points where you have to give advice saying you need to stop thinking and actually start having a go, and stuff like that. But essentially it's stepping into that, come on, think about what needs to be done here. How are you going to go back about it? What do you need to know? And what are you going to do? So, there's a whole range of thinking about open and closed questions, leading questions, clarifying, talking through. I think talking through is quite a good one. Talk me through what you're going to do and how you're going to do it. Gives you, as somebody who's coaching, an idea of where they are, what they know and what they need to know. Looking at using these kind of techniques to build your skills, to build their skills, to develop them and enable their learning. So what sort of practitioner do we want to develop? Those with fixed mindsets or those with growth mindsets? Those that want to develop, accept the challenges, work hard, overcome the hurdles, and get the feedback and development, rather than the negative, I'm not going to put my neck above the water, or I don't think I've learnt that at all, I'm not sure what to do. I'm hoping you're thinking of the growth mindset. Feedback, of course, is very important. Everybody needs to have feedback on how they're performing. Asking students to consider how they feel they have done, to gauge their thinking, and then feeding back on how they're doing is a good technique. You might want to use Pendleton's model, which is pretty well described here. So again, the opportunities, the reality, and the will, best way forward, brings you back into the grow model again. So some of you may want to think about doing these activities with yourselves as groups. I'm going to talk through some of them. So what are you going to do if a student asks, so another two students together, one comes and says, a lady wants to go to the toilet and they don't know what to do. And I'm not sure yourself. What if you're not sure yourself? The goal is the patient gets safely to the toilet. But what's the reality is it's about the knowledge, what you need to know, and then you start to move into the options. Where am I going to find out the information I need? Who am I going to ask? Who could I get to come and assist me? What they should decide to do should be what is safe for the patient. There's also a time frame in this as well, of course. Somebody wants to go to the toilet and you want to be able to enable them to do so as quickly as possible. So wound dressing, they haven't come across before. Again, think about their existing knowledge, think about what they do and don't know, think about what needs to be done, what are the different options and alternatives, and deciding to do that. When asked this, a lot of students said, oh well, you can observe one. It is true, but I've also again met students working in CLIP who have done wound dressings or catheterizations. They know the principles, they understand what it's for, but they've never done it before, and they have actually successfully been coached through undertaking an aseptic technique that they've never undertaken before. Again, obviously the patient's safety and comfort needs to be thought about, and you need to think about how much time it may take to go through that process, but it can be done. And it is been demonstrated that by being coached through things, students will retain and understand and learn better. Okay, somebody comes to a respiratory femur. Again, what are the key things? Most lay people know that if there's a suspected fracture, there are certain things that need to be checked out first, need to be done, and the best course of action. So even if you are treating the patient, you are talking to the student, asking those inquiring questions, ascertaining their knowledge, and enabling them to understand the processes around caring for somebody in ED department with a suspected fracture. So a student has to hand over a bay or do a ward round, and again, that's very nerve-wracking. I've met many registered nurses who find that nerve-wracking. How can we best prepare our students? How can we prepare them to be able to do this from day one of registration? Actually, they need to do it from day one of clinical practice. Again, I spoke to a first year student who'd been on the ward for about 3 weeks. She was very excited that she had spoken to a consultant about the patients she had been delegated to look after, and had decided a plan of action with that consultant, and was engaged in some discharge planning when I met her. She felt she had the confidence, because of the collaborative learning environment, to be able to hold a conversation with the patient's consultant. If you can do that in your first year and build on that and develop that, think of how that prepares you for registrant practice. Okay, so our patient deteriorates, has a cardiac arrest. Can you be coached through this? Can people coach through this? What are the ways you can still use those encouraging, inquiring questions? When's the best time to do this? When can it take place? Do you do it afterwards and with reflection? Do you talk them through things as it's going on? Good way to learn. So, you could still say, what was the goal, what was reality, what were the options, and what actually happened. And what should you do then from that if it occurs again? A good way of learning. So what we're doing is we're asking people with the CLIP environment to reflect before action, but also to reflect on action, and also again reflect after the action, bringing in all those kind of distinctive tilts on reflection and building those reflective skills so that they become second nature, so that they're actually, when they're working, thinking in this way, using the GROW model. What's my goal today? What do I need to do? What do I know? What do I need to do? Where are my options? What should I be doing? And what should I decide to do and do it? And through coaching, this can happen. This is available as a PowerPoint separately on its own. Please watch this YouTube clip of students and staff's perceptions of how the CLIP benefits. So a team of us went to Lancashire Teaching Hospital to see it in practice. I've talked about the first year who had a lot of confidence. It does put the students at the centre of learning. It develops professionalism within the students, and the mentors we met embraced coaching and expressed positive views expressed by patients. It no doubt undoubtedly improved the recruitment retention of their staff, and staff felt valued because they were all engaged within this collaborative learning. We met a preceptee who was coaching. She had taken a job on the ward because they had CLIP in place and she had experienced it there as a student, and that just underpins the recruitment. Obviously you're not able to ask me any questions, but I'm happy to receive questions from you. And there's some of the references that we talked about. Thank you for listening.